everyone. Welcome to the foster care volunteer orientation. If you are watching this video, then you are already a current volunteer with us and you are looking to get started as a foster. So welcome. At the top of the screen, you can see our foster care coordinator. She works mainly out of our Orlando shelter. Her name is Susan. I'm sure you have seen her around or heard her name. If you need anything as a foster or if you have any questions after this presentation, feel free to contact her and she will get you set up and started. So the mission here at the Pet Alliance of Greater Orlando is to educate, shelter, place, and heal pets and their families with compassionate, responsible care maintained to the highest professional standards. And our vision is to create more caring communities by promoting happier, healthier pets and their families. We are a 501c3 nonprofit organization. We were founded in 1937, originally starting as a society for homeless children and animals, and evolving into handling just animal cases shortly thereafter. We are the oldest, largest, and best known animal welfare agency in Central Florida. We were previously the Orlando Humane Society, and then we merged with the Seminole County Humane Society to become the SPCA of Central Florida. In 2015, we became the Pet Alliance of Greater Orlando, just so that when people were donating to their local nonprofit, they understood that they were donating to us and weren't getting us confused with larger organizations such as the ASPCA or the HSUS. We do not receive any funding from any of the large three organizations in the nation, the HSUS, ASPCA, AHA, or the government here in Central Florida. Our money all comes from clinic services, donations, fundraising, and different grants that we can apply for. We accept here any and own all dogs and cats regardless of the age, health, or behavior of the animal. The exception to this is kittens. When people find kittens, we will take in those as well. There are an abundance of kittens in the Central Florida area, and Orange County is not equipped to handle all of them, so we do try to help them out as much as possible and take in kittens when they are found. We are not currently affiliated with any animal control or animal services organizations. Usually each county has their own separate entity for their animal services divisions. They usually are government funded and they will take in all owned animals, stray animals, and found animals in that given county. We do currently have a live release rate of about 98.5%. That's the percentage of animals that find homes through our shelter and leave us alive. We do not euthanize four-timer space here at the Pet Alliance of Greater Orlando, but we do sometimes have to make difficult decisions regarding the health or behavior of the pets that enter our facility. We do have two shelters with adoptable animals. We have our Orlando shelter, which is the larger of the two and houses the administrative offices. We also have a Sanford shelter that is smaller, but they definitely still utilize fosters for kittens and puppies. So we do ask that you pick one shelter or the other shelter to foster at. Unfortunately, the system that we use only allows us to choose one or the other and not both. So we do ask that you choose a main shelter to receive emails from regarding foster animals. We also have two full-service clinics, one in Orlando and one in Sanford. And then we have an Alafaya clinic, which mainly focuses on TNR, spaying and neutering, vaccines, and microchips. They don't usually do wellness appointments. And then we have two shelter medical departments that are dedicated to our shelter pets while they're in our care, and they do service our foster animals as well. So we are here because of pet overpopulation. Statistics say that for every person that is born, 15 dogs and 45 cats are born. So that is completely crazy unless every single person is going to own that many animals, which is just not going to happen. So one unspayed female cat produces over 12 kittens per year here in Florida, and definitely in Orlando. We see a large increase in the amount of kittens that are produced per year for each female cat because they kind of consistently reproduce. We don't have seasons like they do up north, so they just continue to reproduce. Every time they get rid of a litter, they're ready for another. So we definitely see a higher number of kittens than you would in other areas of the country. One unspayed female dog can produce between 6 and 10 puppies per year. Again, that can increase here in Florida, but we definitely see a lot less puppies than we tend to see kittens. So what we're doing to help in the community, we do offer low-cost spaying and neutering through all of our clinics. We have a TNR clinic at Alafaya specifically for community cats and getting them back into the colonies, spayed or neutered. We offer education for school and group presentations and summer camp over the summer for elementary and middle school children to be able to offer them that education early on in their life. And we do also have some youth volunteer opportunities for. So the foster program is definitely a critical part in our ability to save and adopt out so many kittens and puppies annually. We could not do it here without our foster volunteers. We just don't have the time, space, or resources to care for all of the animals that we get in. Fostering is incredibly rewarding. You get to see them grow and develop and change right before your eyes. And you get to see every moment from, the time they're 2 weeks old until they're 8 weeks old and going into their new home. So it's definitely a rewarding experience, and you learn a lot by doing it. Okay, so who ends up needing to be fostered? Kittens and puppies that are less than 8 weeks old are the majority of the animals that we send into foster care. Kittens and puppies have to be at least 8 weeks old and at least 2 pounds before they can be spayed or neutered and go up for adoption. So that is what we see the most of, and that is what you're going to see the most emails for when you start fostering. We also tend to receive nursing puppies and kittens with or without a mom. The ones that do not have a mom and need to be bottle fed require someone who is home more often and can commit to feeding them every 2 to 3 hours until they are weaned and eating on their own. Nursing moms and litters are by far the easiest set of fosters that you will get because the moms do everything for you and you just don't have to take care of them as much as you would with kittens and puppies that are on their own. They will feed them, they will clean them, they will start socializing them. So you're there to socialize them with people, but otherwise the moms tend to do everything for you. We also will send animals recovering from illness or surgery out into foster care. This can be something as easy as an upper respiratory infection for a cat or a dog, or a cat or a dog or kittens with scabies or ringworm. We also provide as much as we can medically for animals. So if an animal needs a limb amputated or some kind of major surgery that is not just a spay or neuter, then we will also try to send them into foster care so that they aren't recovering here at the shelter. We also get in animals in need of socialization. It doesn't usually happen that we get dogs in that are that unsocialized that they need to go into foster care. This usually pertains more to kittens that are caught outside and are still in an age range where they can be rehabilitated and be socialized. Usually once you hit the 3-month mark with kittens, it's very difficult to get them socialized to a point where they will survive well in a house with a lot of people or with children. But kittens that are younger than that age can easily be rehabilitated and become friendly, loving kittens. They just need to be shown what that is like living in a household and being handled by humans all the time. So the benefits of fostering really help the shelter. The shelter environment is pretty stressful. There's a lot of sounds, noises, smells, and it can be very difficult for animals to go from a home into a shelter environment, even at a very young age as a puppy or a kitten. So removing them from the shelter environment lessens their likelihood of getting sick, and it helps socialize them and keep them friendly with people. Kittens and puppies don't have a fully developed immune system, so they are more likely to get sick while they're here in our care. That's usually just an upper respiratory infection. And in foster care, the animals receive a lot more socialization than they would here. We don't have enough staff to be able to socialize every single kitten at every single moment of every single day. But if you have people who are home all the time, or you have kids that come home from school and just want to spend all of their time with those kittens in the bathroom, then those animals are receiving so much more love and affection than they would being in our care here. So it just really helps them out. We provide all of the veterinary care for our foster animals. This is not something that you will have to make a financial commitment for. We have a shelter vet here Monday through Friday. Susan is usually here on Saturdays, so she can provide certain veterinary care for kittens over the weekends. We do also have our public clinic open on Saturdays, so the vet in the public clinic is able to see foster animals if needed as well. We do ask that you try to make an appointment for vet checks through Susan, just so that our vet is aware of you coming in and is prepared to see you. She does surgeries in the morning, so if you need to drop the animals off in the morning and pick them up in the afternoon, that usually works the best. Or if you can come in the afternoon after 2 o'clock, that's usually when she is ready to do her veterinary exams. So that just works better for her schedule. So we do ask that you communicate with us ahead of time to ensure that she'll be ready to see them. If there is an emergency or it is a weekend and you want to know how to best proceed, we ask that you email one of the shelter managers and the foster coordinator at that shelter to ensure that they are aware of the emergency or the medical situation that is going on in your home, and they will best advise you as to what to do. We do work with emergency clinics. It's the Veterinary Emergency Clinic of Central Florida, so they will provide a lower cost for us if any of our fosters do need to seek emergency medical care, but we would prefer that our vet at the shelter look at the animals first and to keep that patient with that vet. So definitely let us know. Sometimes it is not actually an emergency and can wait for the shelter vet on Monday. So just communicate with us and we will tell you how to best proceed with that. Foster rechecks will usually happen about every 2 weeks while you have foster animals in your house. Nursing puppies and kittens under 6 weeks old might be seen weekly depending on their health and how they're gaining weight. All kittens and puppies have to be seen at 6 weeks old to receive their first vaccine, and we test kittens for feline AIDS and leukemia. At 8 weeks old, they'll get a second set of vaccines. If they are already over 2 pounds, we do usually keep them to be spayed or neutered and to go up for adoption. So please be prepared that once your kitten hits that 2-pound mark, that we will probably keep them at the shelter. We want them to go home as quickly as they can to reduce their length of stay with us, so we do usually keep them at that point in time. When you come in for your foster rechecks, you'll usually have an appointment with the foster coordinator just to ensure that they are ready to see you when you get here. So please bring a fecal sample with you when you come in just so that way we can test for intestinal parasites. Even if the last fecal test was negative, we still want to continuously do them because sometimes something pops up later on. Rechecks for adult animals depend on the medical need and what the veterinarian wants to do at that point in time. So we will communicate when you need to have your recheck scheduled, and we'll get you on the schedule for that. Okay, so diarrhea. Something that everyone looks forward to with kittens and puppies. Just kidding. So it's very common for shelter animals to have diarrhea. It can vary from stress to an infection or parasites. If you are changing their food, their body is just responding to all of these changes, and it's very common in adult animals and in puppies and kittens for them to have diarrhea. So the biggest thing is that you want to be careful that the kittens and puppies do not become dehydrated. They are the most vulnerable at doing so, so just make sure that they are drinking plenty of fluids and still eating. If you start to see soft, mushy poop, you can start them on pure pumpkin puree. It's like a quarter of a teaspoon mixed in with their food at each feeding. It helps both constipation and diarrhea. So either way, you can start to give that and see if it helps. Now that won't help if it is an actual parasite that they have, but it'll start to harden the stool until you can get in with an exam. You do want to make sure that you email or call the foster coordinator to schedule an exam, and make sure to bring a fecal sample with you. If you are complaining about diarrhea and do not provide a fecal sample, it is very hard for us to treat that animal because we want to make sure that we find any parasites that they might have and that we can treat them appropriately. We may end up just prescribing you an antibiotic for diarrhea called metronidazole, or suggesting a probiotic or the pumpkin if you haven't tried that already and we do not see any parasites. But we usually will also send you home with dewormer. Just remember, kittens and puppies, kind of like babies, cannot control when they have a bowel movement, and sometimes they'll go where they are. So it's a really good idea just to keep them in a bathroom or where the flooring can be easily disinfected and there isn't any carpeting or a lot of linen that you are unable to wash easily. You want to try to keep them in a tiled area that you can easily wipe up anything that might happen. This is just a little feces reference chart to look at when you see their stool. What you want to hope for is the type 4, which is just smooth, normal poop. If it starts with type 1, type 5, 6, you can start to give them that pumpkin and try to loosen it up a little bit. When you get to type 7 and it's completely watery and they just have liquid diarrhea, you definitely want to let the foster coordinator know so that we can get you in for a fecal float and to give you any dewormer or antibiotics that we can, because that again is when they can become dehydrated and stop eating and not really feeling like themselves. So diarrhea might be because of parasites. So the most common parasites that you're going to see are the ones that we have listed here. The first one is roundworms. Roundworms look like long spaghetti. They can be between 3 to 4 inches long. It's the top photo on this slide. They can get it from their mother through the milk, and adults can get them from ingesting a rodent. Hookworms are much smaller, and they can be like they can look like roundworms, but they're shorter and can be flat. They feed on the blood, and they can cause anemia. With hookworms, you will often see blood in their diarrhea, and both of these can be seen on a fecal float, so please make sure that you bring in that fecal when you come in for their vet exam. They are both contagious to other animals, So if they're sharing a litter box, we will treat both of them. So even if you can only get one fecal sample and not one from each kitten, it really doesn't matter. If it shows up on one set of feces, we're going to treat all of the kittens in that litter for the same thing. Tapeworms are usually seen when kittens or puppies have fleas or have been treated for fleas. They can cause vomiting and weight loss. They look like little pieces of rice in the feces. They get it by ingesting a flea or a rodent that has it already. When they are infected, we do have to give them an injection to get rid of the parasite. So you do have to bring the kittens or puppies in order to get them treated for that. That is not contagious because it's not passed through the feces. Coccidia is one of the most common forms of parasites that we find in kittens and puppies. It causes very watery diarrhea. Sometimes it has blood in it, and they're usually not able to control that bowel movement. They often get it from the mother because of the proximity to the feces and the kittens and puppies, and they explore everything. It is contagious in the litter, so we usually will give you the dewormer for that, which is called Panazrol, and we'll give you 3 doses in order to treat that. So scabies and some of the other medical concerns that we're going to talk about from here on out can be pretty scary for fosters. Because maybe you've heard it before and you've heard about a person getting it and you don't want to have to deal with that in your home or disinfecting, things like that. But it's really important because we do see it quite often. We see scabies, ringworm, Demodex, and we're going to talk all about that in a second. But they're very easy to treat, and the treatment tends to go a lot faster in a home environment than being here in the shelter. They're also more likely to get sick on top of the scabies or ringworm, so having them in that home environment can, stop the spread of disease pretty easily. So feline scabies, you're going to start to see crusts along the tips of the ear. You might see it on the nose, on their toes. It's pretty uncomfortable for them. It can spread throughout their entire body. It's really easily treated with Advantage Multi or Revolution. It's given on day 1 and then repeated in 2 weeks, and then we usually just wait a week after that treatment to ensure that their skin scrape is negative. Humans cannot contract this type of scabies, so you don't really have to worry about that. Other cats can, but we ask that you keep the animals separate from your animals at home anyways, so you shouldn't really have to worry about that. You can see the photos on the side. This was a cat that we recently had in foster care, and you can actually see the transformation in the cat from the first day that it came in to the time it got adopted. It's only a 3-week process, super easy. We do see kittens and cats with it quite often, so it's really easy to treat at home, and it's good to have fosters that are willing to do that medical issue. Ringworm can be seen on both cats and dogs. It is a fungal infection just like a human would get. It is the most contagious skin infection that an animal can get. The warm, humid environments encourage it, so unfortunately here in Florida, we actually see it quite often. They usually have a skin lesion on them, a red circular patch. It can appear differently just depending on where the patch is and how long it's been there, but it tends to be a scaly little skin patch that you see. Usually what we'll do is we will collect the scales and the crust from that area, and we perform what is called a DTM culture. The culture has to sit for 2 weeks, and then the vet will look at it and determine if there are spores in the culture. We will usually send you home immediately with treatment if we feel like it probably is ringworm. It is a lime sulfur dip. They can stink and they'll turn their coat yellow, and can also dye random things around your house yellow if you let them run around. But if you just keep them in a bathroom or a bathtub or in a crate while they're drying, it's really easy to do at home. And it's not likely that you will get it from them. You can if your immune system is not fully developed, or if your immune system is suppressed for one reason or another, but it's not really that likely. Demodex is similar to scabies in cats. It's super easy to treat, but it is not contagious. So it is not contagious to people. It is not contagious to other animals. It is a mite that is already on their hair follicles, and they can reproduce and kind of irritate the skin more if the animal is stressed. They can get it from their mom, so we usually see it more in puppies or in adult dogs that have not ever had any treatment for it. Very easy to treat. We give a dose of Bravecto or of NexGard, and sometimes they'll require antibiotics, or twice weekly shampoos, just depending on how bad the skin condition is. It does smell a little bit like a skin infection, so the smell you can kind of, you have to get used to at first. But it's not horrible, and they're just a normal dog, so you don't have to worry about anything else with them. The only catch with these Demodex puppies and dogs is that the foster time tends to be a little longer, just depending on where they are in their treatment and how quickly their skin is healing from that infection. So URI and kennel cough we see the most of here in the shelter environment. With cats, it's called an upper respiratory infection. You'll see nasal or eye discharge, sneezing, coughing, loss of appetite, lethargy. We treat it orally with antibiotics for 14 days. We will do eye ointment or a nasal drop if needed. The animals do need to be isolated from your other pets. If a cat has an upper respiratory infection, it cannot be transferred to a dog or vice versa, but cats can give other cats URI and dogs can give other dogs kennel cough. With dogs, it's the same symptoms, except you'll see coughing as well. They are also treated orally with an antibiotic for 14 days. We do ask that your pets at home remain isolated from your foster animals for a certain amount of time, or until the foster coordinator feels comfortable with you introducing them to each other. Cats and kittens, especially when they leave our shelter, they tend to get sick within 14 days. So if you take cats or kittens home with you for a foster or as a foster, they will most likely come down with an upper respiratory infection. It is very rare that fosters bring their cats back and they have not already been treated for an upper respiratory infection. But again, it is much easier to treat at home in a home environment than it is here. They are less stressed and they're happy and they're active and playing and eating, and they need to continue to do so in order for the treatment to go quickly. So sometimes you'll see kittens clear their upper respiratory infection within 5 to 7 days. We do ask that you continue the antibiotics as prescribed until the vet clears them, but most of the time they recover a lot faster than they would if they were here in our care. So something to remember is that fosters may choose which animals they foster in their home. We will send out an email, usually weekly, sometimes twice a week, just depending on the need and how many animals we have awaiting foster care. And we try to send as much detail as possible in those emails so you can pick through and decide who you want to foster. Now, I will tell you, when we have a limited supply of kittens for foster care, it's a fight to get those kittens. So you have to be on top of your email and If you want a certain set, email back as quickly as possible. We will confirm with you that you need to come pick up the kittens and when and what time you're going to be here, because if there are multiple people that said that they want a specific set, we will do first come first serve, or whoever can come pick up the kittens first. But please wait until you receive the confirmation from us, so that way you don't drive all the way to the shelter and then not have any kittens to take home with you. We do try to get the animals into foster care as quickly as possible, usually within 24 hours, or at least after we know that they are eating or thriving in our care. We do provide any necessary supplies, food bowls, towels, a carrier, puppy pads. If you need bleach or anything like that, we have supplies available. We do rely on donations, so sometimes we will be really low on food or on puppy pads. We always tend to have bowls or towels or carriers. But certain supplies we do have a limited donation supply of. So we'll give you a starter bag the first time you foster with us with necessary supplies. But we do ask that you're fully ready to purchase food or litter or other supplies as needed if we don't have it immediately available for you. Excuse me. So how long will you have the animals in your care? Usually kittens and puppies are only until they are 8 weeks old and at least 2 pounds. Sometimes you'll have them longer if they have a health issue going on, if they get an upper respiratory infection at the end of your fostering. We might extend it a little longer just so that they are treated in your home. It really just depends on the health of the animal that you have in your care. Animals recovering from surgery or illness, it's usually about 2 weeks. It just depends again on what is going on with that animal. If it is a really invasive surgery, the vet might request that you have the animal for 6 to 8 weeks, just depending on what it is. Animals requiring socialization, it's usually between 2 and 4 weeks. It really, again, just depends on the animal and how quickly they turn around. Demodex dogs or puppies, it's usually 1 to 2 months, just to ensure that their skin is at a point at which our vet feels comfortable spaying or neutering the pet and them going to a new home. So we do ask that your personal animals are spayed or neutered and up to date on all vaccinations. We update all vaccines when animals come in. Again, kittens and puppies cannot receive their first vaccines until they are at least 6 weeks old, so some of them might not be vaccinated immediately when going home with you. We ask that your pets at home are spayed or neutered, because if you are fostering an adult animal and they are not yet spayed or neutered, we don't want any intermingling and things happening. So we do ask that your pets at home are already altered. You do have to have an area in your home to separate the foster pets from your personal pets for safety and health reasons. Sometimes after a certain amount of time, the foster coordinator will say you can go ahead and mix them. But we have seen it time and time again where someone decides to mix their fosters in with their personal pets, and then the foster, starts showing signs of ringworm or scabies, and now those pets have been intermingled and your animal has to be treated. At the Pet Alliance, we do not treat your personal animals. If you choose to mix them and something happens, that is unfortunately on you, which is why we're telling you to keep them separate. You don't know what these kittens or puppies could possibly have, and you don't want your pets at home catching it. So please keep them separate. It's also just a lot cleaner to keep them in a special foster area, such as a bathroom or a room with tile where it can be easily disinfected, and not having them running throughout your house. You also have to be able to transport the foster pets to the shelter for vet checks and any medical treatment. So when you receive those emails, please double check and make sure that you are not going on vacation, your job isn't going to call you in a lot, and that you have the time to fully commit to the animals that you are saying you can take. So when you bring home puppies, again, we suggest keeping them in a kitchen or a bathroom where it's easy to clean and disinfect. You want to make sure that they stay in a warm area, maybe where you can switch the vent off in that area so that way they don't have the air conditioning blowing at them. You want to make sure that you pick up any small items and that there aren't plants or anything that they can really chew on. The puppies should be around humans for socialization and shouldn't really be kept isolated from humans. If you are keeping them in a bathroom or a secluded area, just make sure that you're socializing them during the day and they will be perfectly fine. You can keep them in a crate when not under supervision. We can give you a crate if you will need it. I would suggest, even if you're keeping them in a bathroom, to ask us for a crate to set up in there and crate them with just a towel or a blanket while you are gone, so that way they aren't chewing up anything. If you believe that your house is puppy proofed, it still probably isn't. So just ask us for a crate or a carrier if you would like one. Puppies can only go outdoors if supervised by an adult. They should not go off leash in any area. They are not fully vaccinated. You want to make sure that if you are taking them outside, it's literally just in your backyard where you're controlling the environment. You don't want them walking where random dogs have been, because you don't want them catching anything that those dogs have. They should not be exposed to any other dogs or places like dog parks or PetSmart or Petco, anything like that. You don't want them walking on the floor. So if you're taking them with you to a store, let's say, you do not want to put that puppy on the floor. There is a lot of risk for the spread of disease and illness, especially parvovirus, which we're going to talk about in a little while. So please make sure that they are not exposed to any other dogs or places frequented by other dogs. So this is just an example of some puppy-friendly areas that you can set up. One is pretty simple. It's just a crate and a little gate around the crate and just a puppy pad, their food and water dish, and some toys. Again, it's on a tiled area where it can be easily cleaned. The second one, the person actually purchased an actual playpen where they have it all set up with a little puppy playground. This one, instead of using puppy pads, they have puppy litter where they can dig and kind of get a little more potty training instead of going on a puppy pad. They have the crates that they can put them in, and they have some toys in there. They also have some paper towel handy already in case there is a mess. Again, it is on a tiled area, so it can be easily cleaned up. You can, of course, put them in the bathroom. That's the easiest place to put them, is in a bathtub. If they are getting bigger, I would suggest maybe having a little bit of a bigger bathroom or area to keep them in, because they can jump out of the bathtub and you don't want them hurting themselves. But both of these areas are definitely Pet Alliance approved. When you're bringing home kittens, it's pretty similar. You want to make sure bathrooms work really, really well for kittens. You want to make sure that there isn't a place where they can hide and you can't locate them, and that they're getting the proper socialization. You can disinfect any areas with mild bleach, which is 1 part bleach to 32 parts water, and then rinse it with water after. The area that you have them in, you want to make sure that it can withstand kitty messes, litter box accidents, vomit, spilled food or water, spilled litter. They tend to kick the litter everywhere. You want to make sure that it is warm and draft free. Excuse me. That there aren't any small items, again, that they can chew or swallow, and that there aren't any wires. Kittens find anything and everything, just like the photo with the toilet paper roll. They will play with any little thing that is on the floor. So just make sure that you are picking up everything. You do want to make sure that the toilet lid is closed as well, because they will definitely explore and try to jump up and climb on things. Kittens are not to be taken outside, even if you have trained a kitten or a cat to be on a harness previously. Please just leave the kittens indoors. When feeding, they do need to have access to food and water 24/7. Kittens and puppies are pretty active. We do ask that you try to feed puppy and kitten food and not just like an adult version. There are brands that are all life stages, which are really good as well. Sometimes if we have food and we only have a certain type of food, we'll give you that. With kittens and puppies, you want to try to give them just canned pate food, which is like the ground mushy food without like the shreds or the chunks in it, and then slowly start introducing moistened dry food or just dry food into their diet. You can also mix in formula specific for puppies or kittens if you need to, just to kind of entice them to eat a little more. You do want to feed them with the canned food 3 to 4 times a day and have a bowl of dry food available and a bowl of water available. Kittens and puppies do not drink human milk, so please do not give them human milk. If you think that they need formula, or if we suggest that you use formula, please get it from us. We use KMR. It's just the best for them. We also use Breeder's Edge. There's a list in the foster manual for you about using formula, but you can ask us for a can if you need it. If we definitely think that you need it, we'll send it home with you at the time of pickup. So kittens should be gaining about a half an ounce every day or 4 ounces per week. We weigh the animals in grams when you do your checkups. So if you have a kitchen scale that you want to use, and weigh them in grams, so that way you can kind of compare our scale to your scale. You can do that if you want to keep a chart. If you're going to be weighing them all the time, you want to weigh them at the same time every day, and after or before a feeding. You don't want to feed them one morning and weigh them right after they ate, and then the next morning feed them before they ate. Just make sure that it's the same time and same feeding schedule every day. If there is a lack of a weight gain or they lose weight within 24 hours, you do need to let us know, so that way we can get them checked out. Most of the time it's just intestinal parasites, but sometimes there can be something else going on, so please let us know. Puppies should be gaining 5 to 10% of their weight each day, so that just kind of gives you an average amount. So we're going to talk a little bit about kittens and their development. So what is a neonatal kitten? Kittens that are newborns and newborns to approximately 4 weeks of age, you can consider a neonatal kitten. They're completely helpless. They're not able to regulate their body temperature. You do have to keep them warm on a heating pad or in a warm area. You usually need to bottle feed them, and they cannot urinate or defecate on their own, so you have to stimulate them. They do need to be weighed daily to make sure that they're gaining weight with their feedings, and you do have to keep them clean and dry. You physically have to do it. Without a mom, that is on you to do. Moms will take care of all of that for you. They'll regulate their body temperature for them. They will feed them. They'll clean them. They'll keep them nice and, dry. But without the mom, you're their mom. You have to be able to do that for them. So if you have a bottle feeder, you never want to feed a cold kitten, and you never want to feed a kitten cold milk. You don't want to feed them any cow or goat milk. We only feed KMR. It's a special kitten formula. They usually like it the best, and it doesn't usually give them diarrhea, which is why we use it. Before you start feeding them, you do want to gather everything that you need in order to feed them so that you have everything handy before you begin. You are going to position the kitten on its belly, almost as if you are the mom. They'll start kneading on your hand as they're suckling on the nipple, and that way they don't aspirate and get any formula into their lungs, causing pneumonia. You do want to let them suckle at their own pace and not force feed them with the milk. Even if you think it's not coming out, it probably is. If you don't think that the milk is coming out, remove the bottle from their mouth and kind of squeeze it on your hand or on the towel just to see. Sometimes the formula, if it didn't break up all the way, it might get stuck in the nipple, so you can test it out on your hand. Do not test it out while it's in their mouth. The bottle should be held at a 45-degree angle to allow them to swallow, kind of like you would with a baby. And you want to utilize a blanket or a towel to kind of lay them on, so that way they have some support. You never want to put them on their back because that is when they're going to aspirate. So just for some development information, so birth to 2 weeks old kittens are born with their eyes and ears closed. The top photo, they're probably a day or two old. Their eyes start to open around 7 to 10 days, and their sight is fully developed by 5 weeks of age. Their eyes are blue for several weeks. They usually end up changing. At first, they do have blurred vision, and they should be kept from bright light so that you don't hurt their little eyes. Their sense of smell starts developing, and they do become more aware of litter mates being present in this time. By week 3, their ears are usually open and their sense of hearing has developed. They might startle at loud noises, and their ears might pop out and be fully erect. Their sense of smell is fully developed usually. At that point, they will start to eliminate on their own. Some might not, so you still want to watch them and make sure that they're urinating or defecating on their own, but they should start to do so by themselves. You can introduce a small litter box. It's not likely that they'll use it, but you can start to try to train them with the litter box. Sometimes they start to purr, and their little baby teeth start coming in. At 4 weeks old, they start standing and walking around. They'll be really clumsy and kind of funny to watch. Their bodies are out of proportion. Their heads tend to be really big, and their tails are short. They will interact more with their litter mates. You might start to see them attempting to play and kind of pawing at each other. They'll start to kind of walk around and explore everything, but if there is a mom, they'll continue to nurse, and they might still continue to bottle feed at this point in time. So once you hit weeks 6 to 8, they are hilarious. They start playing. They become the fun kittens that you looked for that entire time. They start playing with each other. They start playing with toys. You'll just kind of see them grow and develop. They will start using the litter box. They'll start eating on their own. That is the most critical time for that socialization and playing with them and interacting with them, making sure that they are getting the playtime that they need. Around 4 to 5 weeks old, kittens will start weaning, so they can be introduced to canned food. We look for food where chicken is the first ingredient. You don't ever want to use seafood. It tends to give them diarrhea, and it also makes them picky eaters later in life. So you want to try to find one where it's chicken, beef, turkey, duck, things like that. You do want to make a gruel of canned food and formula at first when you're weaning them. Just a little bit of the water and the formula mixture, and then just pour it over the canned food and kind of mix it up really well for them. You want to use a low dish or plate so that way they can reach it easily. It will be pretty messy. You can kind of see in the photo that the food is everywhere. They are face first in the food. You don't want to force them to eat. You don't want to kind of shove their face in it. That's just not fun for them or you. You can put some on their tongue and try to get them to eat it that way. Some kittens will naturally go right over to the bowl and start eating everything, and some just need a little more encouragement. So you can start to put it on their tongue and slowly introduce it to them. You can also, if you have a syringe, you can kind of suck up the mixture in a syringe and kind of drop it on their tongue to get them to eat that way as well. So fading kitten syndrome is something that we just added into this orientation because we want everyone to be aware of it. The first 6 to 8 weeks of a kitten's life are when the kitten is most likely to develop fading kitten syndrome. Offspring of stray and feral cats are the most at risk. We tend to get the most cats from stray and feral cats that people find. It's not usually that their cat at home had a litter, it's that they found them on the road. The fading kitten syndrome usually affects the smallest or the runt of the litter. It's usually because they weren't able to nurse properly, they didn't get enough milk within a critical time frame. You'll start to see lethargy, lack of interest in eating, sleeping. They are kind of separated from the rest of the litter. Their face will take on a triangular shape. They look kind of sphinx-like in their face. They lose weight rapidly, and they cannot regulate their temperature, so they tend to be cold all the time. When this happens, it is not the fault of the foster or the caregiver. It's not something that can be prevented. If you start seeing any of those signs, you want to let us know as quickly as possible so that we can try to do our best to save the kitten. But it is something that will happen. It usually is in younger kittens. We usually don't see it after 6 weeks of age. We have with kittens that are really ill, but it's usually before that. 1 or 2 of the kittens will kind of fade. So if you start seeing any of those symptoms, please let us know, and we will do our best to provide, the best medical care that we possibly can. But if it does happen in your home where one day a kitten is doing fine and thriving and the next day it's not, it is not your fault. It is unfortunately nature, and when kittens are coming from outside and from strays and ferals, it's just a part of what happens. So it is not your fault, and if, you lose a kitten and you need to take a break from fostering with us for a little while, we completely understand. All of the staff who have ever taken home kittens and have fostered and have had kittens that fade, we all understand, and it is a terrible experience. Unfortunately, it is probably going to happen at some point, especially during kitten season when we're getting hundreds of kittens a week. So it's just something that you should be aware of. So on to the puppy development. A neonatal puppy is the same from birth to 2 weeks of age. They're helpless. They don't regulate their body temperature. You do have to keep them warm. They do need to be bottle fed unless they're with a mom. They are not able to go to the bathroom on their own, so we do have to stimulate them. And again, you do have to weigh them and keep them clean and dry. You're providing all of the care for those puppies because the mom is not there to do so. When you're bottle feeding puppies, it is very similar to kittens. You don't want to feed a cold puppy, and you don't want to feed a puppy cold milk. You want to make sure that the puppy formula is specific for puppies and is not cow or goat's milk. Gather everything that you need. The puppy is going to be on its stomach, just like a kitten, and you want to let them suckle at their own pace. One thing that I did not mention with kittens is there is a nipple called Miracle Nipple. They're on Amazon. We try to send them home with bottle feeder fosters when we have them, but it is a nipple that simulates an actual cat's nipple, and the kittens tend to suckle on it a lot easier than they do the nipples that come on the bottles. The nipples that come on the bottles also tend to need to be cut, and when you cut them, you can cut them incorrectly, which will give them more formula than they need or not enough formula. So the Miracle Nipple is the perfect nipple. It really is a miracle nipple. So if you're going to be doing bottle feeders, which we are always in need of bottle feeder fosters, if you're going to be doing bottle feeders, I would definitely pick up a pack on Amazon. I think they're usually like $35 for a 6-pack. And you can sanitize them and reuse them. It's not something that you're going to, need to throw away the nipple all the time. And it fits on a normal kitten bottle that you can get at Walmart for $1. So from birth to 2 weeks old, puppies are also born with their eyes and ears closed. They're born deaf, blind. They kind of don't walk. They kind of just hang out. There isn't really any difference in brain activity between sleeping and when awake. They tend to open their eyes between 10 and 14 days old, and they'll develop their sight fully by 8 weeks of age. They do tend to have a blue, grayish colored iris until it can, develop into the color that it'll be. They are not able to support their weight, and they tend to crawl on their bellies. At week 3, they tend to pep up pretty quickly. They'll usually be able to stand between 15 to 21 days. They'll start to explore and socialize with other puppies. They'll learn how to interact by interacting with their mom and litter mates. You can start socializing them really well at that point in time. And you can start to introduce puppy food at week 3 and see if they'll eat it. They'll probably still be nursing, whether it's with a bottle or it's with their mom at that point. But you can start to introduce it. If you start to see them being curious about the food when you're leaving it down for the mom, I would go ahead and start leaving it down for the puppies so that they can kind of get used to it. So at week 4, they are running, playing, their tails start wagging, they, are interacting a lot more with their litter mates. They'll start walking. They'll be a little wobbly at first, but they'll start walking and running around. You'll start to see them being able to control their bowel movements. They might move away from the other puppies or from their area that they lay in to defecate. You can start to give them solid food, which is the pate or the ground wet food, or moistened dry food. And then from there on, it's easy. You're just taking care of the puppies. They'll start playing. They'll start playing with each other. They just need socialization and to be cleaned a lot. Puppies, you do have to clean up after all of the time. Unlike kittens that will use litter boxes, puppies, they don't use a litter box. You can put in their area, like the photo previously, where they do have puppy litter that you can get, where you can get a very large litter pan and put puppy litter in there and kind of start training them to go into the litter, so that way it's easier to housebreak them later on, and they're not going on a puppy pad where you have to clean it up all the time. So that is a good option for you if you're interested in doing so. So with fosters, if you have someone that is interested in adopting the foster from you, they do need to come in and complete an adoption process just as the same as anyone else. For the adoption fees, we have puppies under 6 months old are $350. Puppies and dogs over 6 months old, it really just depends. It can go anywhere from $75 to $250, just depending on the animal. Kittens under 6 months are always $100, and kittens and cats over 6 months old are always $50. You do want to make sure that you let the foster coordinator know, or the manager or some staff member at the shelter know the name and the phone number of the person adopting, so that way the account is flagged as the animal being on hold. You will know when your fosters are ready to have surgery, so we'll have you schedule with the adopter to come the same day as the surgery, and they will finish the adoption process and take the animal home. They don't need to come in beforehand. They can come in the same day as the surgery. So this is just a last little bit. You do want to understand that any damage to property or injury to personal pets are at the expense of the foster care volunteer. That is why we ask that you keep them separate. The animals that you take out as fosters are the property of the Pet Alliance of Greater Orlando, so we can remove the animal from foster care at any point in time. Likewise, if you get into a foster situation and you are unable to keep those animals any longer, or don't feel comfortable keeping the animals any longer, you can of course return them to us, and we will locate a different foster care volunteer for them. If you have any questions, you can feel free to let us know. And you can email Susan, the foster care coordinator, at srussell@petallianceorlando.com. Thank you guys for attending, and we'll see you soon.